Good afternoon, everyone. Thank you so much for joining Back to School with Asthma, What You Need to Know. My name is Melisha Brissett. I am the manager of the health promotion with the American Lung Association, and I have my colleague here. You want
Hi,
to say hello,
everyone.
Sky?
Yeah, thank you so much, Felicia. Hi, good afternoon, everyone. Thank you so much for joining us this afternoon. Hopefully, you're at your lunch break, you have some food, and you're listening to hopefully some good a good webinar. We'll be getting started in about a minute or so, just to allow folks to jump in. But we're really excited to have you here. And again, Stephanie, and I'm also a health promotions manager at the American Lung Association, specifically the New York State Children's Asthma Initiative. Thank you.
Okay, Steph, I'm going to start. It's 12:05. I want to be respectful of everyone's time, but thank you all for joining in. Once again, I'm Alicia with the health promotion team here at the Lung Association. We're going to dive into back to school with asthma and just, I guess, walk you through what families and school staff need to know about asthma as we start up the school year, right? And asthma is something that touches nearly every classroom, and together we can make a big difference in keeping our kids healthy and learning. So, for today's presentation, I'll share the goals and learning objective for a session. By the time we are finished with our hour-long presentation, hopefully you'll feel more confident in recognizing asthma symptoms, right? Identifying triggers, understanding medications, and also feeling confident or comfortable in knowing how to respond to asthma emergencies for your child or students. These goals are here to help both our school staff and our families work together to keep our children safe. On this slide, you'll see how the widespread of asthma really is, right? So over 25 million Americans live with asthma, and more than 4 million of them are kids, right? But it's not the same for everyone. We know that here it shows that Black, Puerto Ricans, and Indigenous children, they face higher risk and more emergency visits. So that means some families face heavier burdens than others, right? Also, an estimated of over 12 million Americans had an asthma episode or an attack. So for our families, just make sure your child has their asthma action plan updated. We're going to dive into that. And also for our school staff, just be aware that asthma is the leading cause of school absenteeism, and we'll also share more about that. So not only is asthma the leading chronic disease for our kids, right, causing limitation to activity, but it's also a costly condition as well. Asthma costs a nation over $62 billion a year in direct healthcare costs alone. And much of the overall health and economic burden of asthma is because asthma is not well managed. And people with asthma end up staying home from work and from school, being treated in the emergency room or the urgent care center for asthma emergencies. And what this translates to is almost 8 million missed school days, right, a year, and over 10 million missed work days. Asthma is, once again, sharing that it is a very important issue throughout the nation, but it's the most common chronic health illness in children and the number one cause of school absenteeism. In a classroom of 30, about three students are likely to have asthma. That means nearly every staff member will encounter a student with asthma. And also to share, every September we see a spike in asthma attacks as children return to school. So they're facing new germs. Sometimes will slip out of their routines with their medication. And the key takeaway from this, we know that asthma can be managed and it can be controlled. Okay, so I'll turn it over to Stephanie to dive into what is asthma.
Thank you so much, Felicia.
Mhm.
So now in this portion of the presentation, I'm going to give you a little bit more of a detailed overview of what is asthma, how does it affect our airways. We're going to be reviewing triggers, warning signs, and how to identify certain triggers at the school. But before we go there, we're going to look at some asthma pathophysiology. So when you think about asthma, you just want to, if there's one sentence that you always want to remember, is that asthma is a chronic condition of the airways. So what it means is that chronic, because it's chronic, it means that it never goes away. There are some common misconceptions that, children may have asthma when they're small, but then they grow out of it. They don't have asthma anymore. That's something that we typically hear from parents, but just know that it is a chronic condition, which means that someone will have it throughout their whole life. It just might mean that there are certain portions of their life where asthma symptoms might be a little bit more prevalent than others. But just know that asthma is a chronic inflammatory disease of the airways. And in this next slide, you'll see the changes that happen inside of the airways when someone has asthma, and also when someone is in the presence of a trigger. So asthma makes breathing very difficult. On the left side of this slide here, you see what a healthy airway looks like. No uh, air is coming in freely through the nose and mouth, and it goes into the airways because there's no obstruction. On the healthy airway, we don't have any swelling, any mucus production, there's no tightening. That's what you see on the left side. But when someone has asthma, they always have that chronic inflammation inside of that airway and some of that mucus production. So just know that these are changes in the lungs and the airways that a patient is not feeling. So the student is not feeling this inflammation and this extra mucus production. What they are feeling though is that tightening of the muscles that surround the airways. So that is what you're seeing on the right side. You see that tightening of the smooth muscle. Just think of it as if you have a rubber band and you put that around your finger and that tightening that's happening, that's what's happening when someone is in the presence of a trigger and they're having an asthma episode. So that is what the patient is feeling. And we like to describe the changes that are happening inside of the airways with an acronym. We like using the SET acronym. S stands for the swelling in the airways, E stands for the extra mucus production, and T stands for the tightening of the smooth muscles that are around the airways. That is also called bronchoconstriction. Later on in the presentation, Melisha is going to show you how different medications attack some of those changes in the airways, very targeted. So next slide, please. When we think about asthma, we like to think of it as a holistic approach. We like to take a holistic approach, and a description that we find to be very effective is the asthma iceberg. So, on the top of the iceberg, so just like the very tip of the iceberg, these are symptoms, these are things that the patient is feeling, is what we see. So, we like to identify that as the symptom. So, that's the coughing, the wheezing, the shortness of breath, and the chest tightness. That's what we think about of the tip of the iceberg. But what there's a whole lot of things that are happening underneath the iceberg, so underneath the water. So we start seeing that chronic airway inflammation or that swelling. So those are some of the changes that you saw in the previous slide. You start seeing that mucus production that can cause that airway obstruction. And if someone has asthma that is not well controlled for for some time, that could cause airway remodeling. But the good thing about asthma is that if someone manages their asthma and is taking their quick relief medication, their controller medication, or their smart therapy medication, this can cause some of those changes to be reversible. But we like to, just show you this example of there's only certain things that you can see with asthma, but there's a lot of stuff that is happening underneath the surface. Next slide, please. So now we're going to talk a little bit more about warning signs. Asthma episodes can start suddenly or they could take a few days to develop. And there are several warning signs that may vary depending on the person, but they can indicate that an asthma episode is, right around the corner. So for some children, you might see an itchy or they might experience an itchy or scratchy throat. They might have dark circles under their eyes. They might be, restless. They might be waking up a few times coughing. And then if someone is using a peak flow meter, we will see a drop in those peak flow meter readings. So just the key takeaway is that with early warning signs, it's a sign, it could indicate that an asthma episode is about to occur. But I want you to know that warning signs are different from asthma symptoms. So in this next slide, we're going to talk about asthma symptoms. Symptoms indicate that an asthma episode is occurring. So some of those symptoms that I was mentioning are the four most common asthma symptoms. So that's the wheezing, coughing, shortness of breath, and chest tightness. That doesn't mean that someone will experience all four of those, right, all at once. Could be that some patients experience more of the coughing. Some might experience more of the wheezing. So that's why it's so important for every patient with asthma, every student with asthma to know exactly how they may react to certain triggers, what their common symptoms are when it comes to asthma. And it is important to know that with symptoms, you might see also a reduction, of course, on peak flow rate, which may be 50 to 80% of someone's personal best. Next slide, please. So now we have a poll question. So before we jump into triggers, which of the following is considered an asthma trigger? So if you can please put that in the chat. You'll see the chat box towards the very top. So if you can please put what you think your answer is. I see Elena said D. What is everyone? Okay, I see, starting to see D. A few more folks, I see their little bubble coming up. So D. So yes, D, it is all the above. So dust mites, air pollution, and emotional stress are all triggers when it comes to asthma. And then the next couple of slides, we'll see what those triggers are a little bit more in detail and what triggers, well, how can we define an asthma trigger as well. Next slide, please. An asthma trigger is a thing, activity, or condition that can make someone's asthma worse. When someone encounters a trigger, it can cause a sudden worsening of asthma symptoms, so a sudden worsening of the coughing, wheezing, shortness of breath, or chest tightness. And on the slide you see on the left hand, we have a list of different triggers. So we have allergens and irritants, which we'll talk a little bit more in detail in the next coming slides. We have infections, how exercise can also be a trigger for some folks, how strong emotions can also influence someone's asthma, and also weather changes. So it's crucial for people with asthma to recognize that asthma symptoms, what their asthma symptoms are, and what is the cause of those symptoms. And that could cause them hopefully to gain control of their asthma because they're able to identify what is making their asthma worse and also ways that they could potentially reduce, avoid, or eliminate some of these triggers. Next slide, please. So now we're going to review a little bit more on what are common asthma triggers. So allergens versus irritants. So an allergen is very different from an irritant. An allergen is very person specific. What that means is that for each person with asthma, the allergens that you see listed, that might not be the allergen for that person. For, let's say, for Lisa, might not be the same as for Joe. It's very, very different because it triggers an immune response in the system, in that person's body. So when someone breathes in some of these allergens, it will cause their body to react differently. So that's why it's an allergen. It's an immune response to a trigger, right? But on the other side, we see an irritant. An irritant is something that is in the environment that can cause some irritation in someone's airways. So it doesn't necessarily cause an immune response, but it does definitely cause some irritation. And when you think about irritant, just know that it can affect anyone. So you don't necessarily have to have asthma to be affected by an irritant. And these are some of the what you see on the screen, like tobacco, air pollution, extreme weather, chemicals or odors, or mold. And an example that I like to give often is, for example, if you all remember a few years ago, there was those wildfire smokes that came from the Northeast. And even if you didn't have asthma, you felt the effects of that wildfire smoke. So that's an irritant, whereas an allergen is very person specific. And some common allergens are dust mites, pests, pet dander, mold, pollen, and foods. Next slide, please. Another common asthma trigger are infections. So especially in the school, when people are going back to school, we start seeing a lot of kids being sick or getting sick. So just know that asthma triggers, that's a really big asthma trigger. Respiratory infections are the leading cause of asthma flare-ups, particularly in children under the age of 10. So you tend to see a lot of viruses like the rhinovirus, and they're typically associated with the common cold and have been usually found in the lower airways of children with asthma. And another common asthma trigger when it comes to infections are bacterial infections. And on on the slide here, you see some other types of infections that can affect someone's asthma. So when it comes to reducing asthma triggers in regards to infections, we want to make sure that we are encouraging hand washing, vaccinations, and staying home when someone is sick to reduce these types of risk and infecting more people who may have asthma. And a key takeaway here is that respiratory infections are the #1 trigger for asthma, especially in children. Next slide, please. So these are other triggers that we also see in children. And of course, we see them in the adult population, but we're just going to focus on children today. A big one is strong emotions. So when someone is crying, when someone's laughing really hard, that can tend to create some changes, or some tightening in the airways, because if someone's crying really, really hard, or if someone's laughing, you're restricting the amount of air that's coming into your lungs, so that can cause, unfortunately, some asthma symptoms. It can cause an asthma episode. Some other triggers are exercise, and that is exercise-induced asthma or exercise-induced bronchospasms, which we'll talk in the next slide. But we want to know and note, especially when it comes to children, that even if someone does have exercise-induced asthma, we want to make sure that we're pre-treating, because we want to make sure that these children are still able to have physical activity. It's extremely important for their development and also for their social development. So in this next slide, we're going to talk a little bit more of exercise-induced asthma. Like I was talking about just shortly a few moments ago, exercise-induced asthma is also known as exercise-induced bronchospasm, so EIA or EIB, and it's defined as the narrowing of the airways due to physical activity. So a small segment of people do experience exercise-induced asthma. However, it's important to know, for example, if someone falls inside of that category, and if they do, it's important for them to pre-treat with albuterol before exercise, before any type of physical activity. Typically, when we start seeing exercise-induced asthma to occur within 3 to 8 minutes of starting some activity, some physical activity, or within 5 to 10 minutes of stopping that activity. So it's really important for someone with asthma to know if they do fall inside of this category of exercise-induced asthma, and to have their medications there if needed. Next slide, please. So now we're going to talk a little bit more, if someone does have EIB, how you can stay active with asthma. So you want to make sure that you are taking your quick relief medication about 15 minutes before you start exercise to avoid some of these asthma symptoms. You also want to make sure that you're starting slowly and doing a really good warm up. You don't want to immediately go into some strenuous physical activity. You want to take your time before you go directly into that exercise. You also want to make sure that you're reducing your heart rate and breathing rate by doing a really good cool down. So that's why, if you noticed that typically it can start 3 to 8 minutes after some physical activity, that could be because someone, probably maybe they didn't do a good warm up, or they weren't doing a good cool down after their physical activity. You also want to make sure that you're stopping activity if symptoms occur. Remember those symptoms, those 4 common asthma symptoms: coughing, wheezing, shortness of breath, chest tightness. We want to make sure that if someone is experiencing one of these symptoms, or maybe a multitude of these symptoms, that they are stopping their activity, um, and hopefully try to medicate with their albuterol right then and there. And that's why you want to make sure that you have it available, especially at the school. And Melisha later is going to talk about some tips for parents to make sure that their child does have their medications readily available. Next slide, please. So these are some common asthma triggers that are found inside the school. So third-hand smoke, that's a really big one. So third-hand smoke is, let's say if there's a school staff, if the teacher smokes outside and they had their jacket on when they're outside smoking and they come inside, a lot of that smoke stays on their clothes. It could stay on upholstery. So it can stay there, and that could certainly be a big asthma trigger for some people. It's a huge irritant. Pest as well. Unfortunately, it's very difficult to get rid of pest, but that has been found to be a really big an asthma trigger. It's an allergen, and pests as in cockroaches, mices. Cockroaches are definitely that big one, especially because it's not only, kind of their mere presence, but also when they die and their body's decaying, that can certainly be an asthma trigger. Another common one is dust. So dust mites. Fortunately, dust is also found absolutely everywhere, also inside the school. It could be on the carpet. Let's say if the teacher has a carpet and that's where they do their story time, that could be a big source of dust, and that could potentially cause asthma symptoms in some children. VOCs, volatile organic compounds, and strong odors. I don't know if you all had it. I feel like I have this vivid memory of whenever I step into a school, I feel like the smell of paint immediately kind of hits me. So I don't know if you all also have that experience, but that can certainly be a really big asthma trigger for some children. Another one is mold, which can be an allergen as well as an irritant, and class pets. I know it definitely does depend on the school district and also on the school, but I do remember when I was younger, I did have like a hamster as a class pet. So this can be a really big asthma trigger. So later on, we're going to go over some remediation techniques or some remediation tips if in your school you have any of these triggers. Next slide, please. So those were common triggers found inside of the school. But now let's think about outside. So what's happening in someone's environment, school environment, that may be causing some asthma symptoms? And a lot of these, unfortunately, we can't really control, but you can control how much time or how much exposure you have to these triggers. One of them is pollen. So it's important, throughout the year, during the springtime, summer, and fall, there's different types of pollen that can happen throughout the year. And really being mindful of, let's say, the pollen count, and that is that day that should really influence the amount of time that you are outside. And we have a slide talking about that a little bit more in detail. Air quality is another common asthma trigger. I explained about those wildfire smokes that you see also in this slide, that how that can truly impact someone with asthma. But air quality also is defined as the amount of ozone that is in someone's environment. Extreme temperature, so if it's really, really cold outside or if it's really hot, that can be a trigger for some folks. And also secondhand smoke. So in the first slide, well, in the slide before, we had third-hand smoke if someone's inside of the classroom, so inside of the school, because it stays to someone's clothing. But when someone is outside of the school, it might be a no smoking zone, but sometimes some people don't really follow those no smoking zones. So students might be exposed to that secondhand smoke as well. But we're going to go over some remediation techniques within the next few slides. Next slide, please. Now I'm going to talk a little bit more about air quality. So in the United States, we use the Air Quality Index, and it's also a part of the EPA, so the Environmental Protection Agency, and it's an index to report air quality. So if you think about the AQI, think of it as a yardstick. So it goes from 0 to 500, like you see on the screen, and they're also differentiated in different colors. So the higher the value of the AQI, the greater level of air pollution and the greater impact on health that can have. So when air quality is poor, you want to make sure that you are reducing the amount of time that you spend outside. So if you look at the screen, we have on the left side the different categories. So when it's green, that means that the AQI is from 0 to 50 and the air condition is good, the air quality is good. And the guidance is that it's a great day to be outside. It's a great day for students to be outside and to play. And there's no restrictions on air quality. But let's go, for example, to the red, to the red category. That means that it's from the AQIs from 151 to 200. So that means that the air quality condition is unhealthy for everyone. So the guidance for that specific category is to watch for symptoms and act as needed, and the duration of outdoor activity should be limited to less than 4 hours. So it is definitely a good idea for schools to have an AQI handout readily available and to get alerts. You can get alerts from the New York State Department of Environmental Conservation, or you can get alerts if you on your app. You can have an app, you can download an app and get alerts as to how is the air quality, or you can even check it out on your weather app and just be really mindful on the air quality of that day. And depending on what it is, you may want to make sure that you're reducing some outdoor activity. Next slide, please. So now we're going to talk about simple and low cost modifications for school environment. So we know that at times funding can certainly be limited at school. So we wanted to provide some low cost modifications when it comes to remediation of asthma triggers. So when it comes to VOCs, we want to make sure that we are avoiding using some of these volatile organic compounds like let's say think about air fresheners, think about strong cleaning solutions like Clorox or bleach. So you want to make sure that you're avoiding this and using some green cleaning instead. When it comes to mold, we saw that mold is a really big asthma trigger. It can be either an allergen or or an irritant. We want to make sure that there's proper ventilation if there is humidity inside of, let's say, inside of the classroom. For mold to grow, there needs to be 30 to, it should not go over. uh, a good humidity is 30 to 50%. If there's more than that, that means it's a good environment for mold to grow. So you want to make sure that you have proper ventilation. When it comes to pest management, so that's integrated pest management. Um, some schools do have IPM that are readily available because that would be, the only, unfortunately, the only way to remediate pest inside of the school would be through IPM. And in terms of smoking, we want to make sure that we are prohibiting smoking inside or outside of your school site. Okay, next slide, please. So we wanted to share with you the teacher's classroom checklist, and this is from the EPA, and it's a tool to go through your classroom to see if there's potential asthma triggers that are there. So I know it's probably really small on your end. We can always send this out via email, but we have different sections here. For example, general cleanliness, and there's questions asking you um, just just general cleanliness questions. You either say yes or no. There's also questions on the animals in the classroom. So if there's a classroom pet, if there's how's the ventilation, how is the thermal comfort, so very specific questions, and it will really guide the teacher through the classroom, through their environment to see what are potential asthma triggers. And if there is a yes, then they can certainly try to do some of those remediation techniques that we mentioned before. But if this doesn't exist, there's at some schools there's an IAQ a person contractor that's there, so they can always give this checklist to that contractor, and hopefully that can help them. That person can help them remediate some of these concerns. But if there's not, then we can always think about those low cost modifications that the teacher can make. For example, if there is a carpet, let's try to remove the carpet from inside of the classroom. If there is a pet, like an animal pet, let's try to not have the animal pet inside of the classroom. If it has to do with like the green cleaning or with like the cleaning solutions having those VOCs, those hard cleaning solutions, let's try to swap that out for green cleaning. Whenever whatever they have is completely finished. So those are some simple modifications that can happen if you don't have a contractor who is focused on more IAQ in your school. Next slide, please. Oh, and
Okay.
now I
So
will, yeah, pass it over to Melisha for a walkthrough on asthma medications.
thanks, Stephanie. So we learned a few things so far. We talked about symptoms. We talked about triggers. We talked about the changes that takes place in the airways. Now we're going to dive into medication, and there are two types of medication that are prescribed for asthma self-management. You have your long-term controller medication and your quick relief medication. The controller medicines, think of your inhaled steroids, right? They work over time and they are taken daily to prevent symptoms. They can last up to 12 hours. I do want to share that with the controller medication, it's important, right, to reinforce our families and our patients that they should stay on this medication throughout the school year. What tends to happen with some caregivers, right? They would stop the medication at the end of the school year. So you have this nice long summer gap where the child isn't receiving that medication. And then September, they're ready to restart the maintenance medication. But we know our summers can provide triggers, right? So think of Stephanie shared the wildfires. We had a few of those. Some kids may be triggered by chlorine, right? So we know that summers, we love those pools. So things like those, it's really important to remember and just remind our families to stay on the medication. With our quick relief medication, it really works to relieve those asthma symptoms such as wheezing, chest tightness, and coughing. If you notice that someone is using this particular medication more than twice a week, it is a red flag that their asthma may not be under control and they should go see their doctor. And this lasts for about 4 to 6 hours. So for our families, the key takeaway from this, just make sure that you understand which medicine is for your child's controller and which medication is for their quick relief. Once again, the long-term medication, the controller, it works on that inflammation, right? That swelling inside of the airways. And the quick relief medication, its job is to relieve that bronchoconstriction, which are the smooth muscles around the airways. For our school staff, just know which students have inhalers and whether they are controllers or quick relief, because that really matters in an emergency. While some students may have both quick relief and controller medication, other students may be on what we call SMART therapy. So SMART therapy, or something referred to as SMART, it stands for single, maintenance, and reliever therapy. And this therapy combines a long-acting controller and a quick relief medicine into one inhaler. This combination can be used daily to control asthma. It's also taken as a quick relief when symptoms start, right, or coughing, chest tightness, and so forth. It is a treatment option for patients who have moderate to severe asthma, but it could be also used for mild persistent asthma, dependent on the patient. This is a great slide that we wanted to share one of the lung association's resource. As you can see, there are many asthma medicines and they come in forms of sprays or powders, right? And this is a great tool that our schools, right, especially our health office, can use to help them with their students learning helping them have their students identify their medication. So most of the times, our families and our students may not know the name, but with this picture, they can point out which medication that they're taking. This slide dives into the importance of a spacer. So why are spacers important? So a spacer helps the children get the full dose of medicine into the lungs rather than having it stay in the mouth or the throat. And from this particular slide, you'll see an image with just the meter dose inhaler and the meter dose inhaler with a valve holding chamber or a spacer attached. So something to take into consideration, meter dose inhalers can spray as fast as 60 miles per hour, right? And with that being said, a lot of the medication can end up in the mouth or the throat instead of into the lungs, right? Get swallowed into the stomach. And when we attach this one-way valve chamber or spacer, it holds the medicine so that our students can take that slow, deep breath, right? That proper technique. And even to consider our younger kids, our younger students who may struggle with coordination, right? The spacer is especially important as it allows them to take that time to breathe in the medication slowly. And some of these chambers, they even have a whistle on them, depending on the manufacturer, and that whistle is a tool that they use to help guide proper technique. This slide just shows the different type of spacers, right? Valve holding chamber spacers that can be available for our students. We have some that will have a mask on there for our younger humans, right? So our little infants, 6 months can also take a spacer, can also use a spacer with their medication. Um, and it's very important to, especially for our health officers and our nurses, just to pay attention to your student to ensure that they have the right device that works for them. And the reason why I'm sharing, we have some schools, some health office in New York, our BOCES site, that really go for the larger spacers with the mask, right? Because they have a larger population of students with diverse learning needs, and they tend to have a difficult time with just the mouthpiece. So these are some of the spacers with the large mask would be something they would recommend for their students. But this particular slide, it shows the resource that we have for medications and device and how to use those medication correctly. On the left of the screen, you'll see how to use a meter dose inhaler with a valve holding chamber. This is, if you scan the QR code, you can actually pull up a demonstration video that will go over the proper technique and how to take that medication correctly. And on the right, that shows the demonstration technique for a dry powder inhaler. So I do encourage everyone to really watch and practice with your child, with your students, just ensuring that they have the right technique when they're taking their medication correctly. And studies have shown that over more than 70% of people that are diagnosed with asthma that they do not use the correct inhaler technique. So this is a big important asthma management step that we want to ensure that our families are doing correctly. Once again, highlighting the importance of proper technique when using all these different asthma devices that I shared earlier. So just reinforcing that technique matters. It matters in asthma control, and it's important for us to just make sure that our families understand how to use it correctly and our students. Now, this brings us to a quick polling question. Um, just to test your knowledge on devices. So, which of the following claims regarding the value of valved holding chambers or spacers is not true? So, A, they make possible administration of the medication from the MDI to very young children. B, they help the medicine move past your mouth and throat, deep into the lungs where it can work. C, avoid problems with spraying and breathing at the same time. D, they can be readily adapted to be used with the dry powder inhalers. Or E, there's a built-in whistle in some models that serve to signal to rapid an inhalation. Please feel free to put your answers in the chat and just, hmm,
I think Lydia just said D. Shelby
mm-hmm,
said D. Trying to see a little bit more D's.
exactly. Exactly. So that is correct. So the incorrect answer would be D, right? They spacers should not be used with dry powder inhalers, right? They're meant for meter dose inhalers. And thank you so much for participating in that. But yeah, that's an important goal for our families to understand their devices and how they work. With this particular slide, just a resource slide, we want to share the tons of information that we have at the Lung Association with you. You'll see information on these are QR codes that will pull up um, different devices, and you'll be able to pull up those videos to see the correct technique. It's also available in English and Spanish. We also have the step-by-step instructions for our schools to share, and there's a QR code on that as well for the to get access to the video. This is a great resource to also share, right? It pulls out the purpose of the rescue medications versus the quick relief medication versus the long-term controller medication, right? So just reinforcing that education. It is provided in multiple languages. So please be sure to download and share this resource with your families. Now I'm going to quickly dive into the asthma action plan, right? So this is a very important tool that provide instructions for managing asthma depending on which zone the child is in, right? So with the asthma action plan, it's a written guide that is created in partnership, and it's a collaboration with the family and the patient and the healthcare provider. And it goes over the medicines that you would take daily, how to handle symptoms, when to get emergency help. And every child with asthma should have an asthma action plan. Here you see the color zones on the asthma action plan. You have green for good control, yellow for caution, red for emergency. And these zones help children and help families and staff know exactly what to do. So for our families, just remember to provide a copy of this with your child's updated asthma action plan at the start of the year. For our staff, please try to keep a copy of this asthma action plan in place for all staff to have access to. And if they don't have an asthma action plan, advocate, advocate, advocate. We want to ensure that all of our students have an asthma action plan and that it's written in the family's primary language, because we can provide these asthma action plan in multiple language, but you want to make sure that the asthma action plan that that family has, it is written in their primary language, and that they can also read the asthma action plan, right? So also considering their literacy level. And just some key steps, right? This is just a simple checklist for our parents and caregivers. We want to make sure that we update the child's asthma action plan, medication administration form, and vaccination before the first day of school. We also want to make sure that you share with your health office any updated health forms and communicate your child's needs, and also ensure that all medication for your child that they're available at school, including the spacer if needed. If you do encounter any difficulties obtaining these extra refills for your school, please communicate with your provider or your school nurse, right? It's important that everyone has a copy of the asthma action plan and the medication, and inform and share. Let everyone know, right, who's around your child about their asthma and how to respond in the event of an emergency. And I send it back over to Stephanie.
Thank you, Melisha. So now we're going to take some moment to some time to talk, to discuss about asthma emergency. So in the case that a student is having an asthma emergency, what should you do? What are the signs of respiratory distress? Next slide, please. So if someone is having an asthma episode, an asthma attack, an asthma exacerbation, they all mean the same thing. Um, and it is a potential that they are having, of course, some a respiratory distress. So if they're having difficulty talking or concentrating, that is a sign that they are in distress. If their wheezing becomes inaudible, it's because there's no air actually coming in or out of their body. This is a big sign of distress. Their skin might start turning gray or bluish. You might see it around the mouth, around their nail beds. So definitely be on the lookout for that. And the patient might have a feeling of impending doom. These are all signs that that this person is extremely they are in distress. We have a really great video here at the American Lung Association on how to respond, or the differences between mild, moderate, or severe amount of respiratory distresses. But because of time, we won't have the time to really go through that. But just know that severe asthma symptoms are a life-threatening emergency. Next slide, please. So this is how you would respond to an asthma episode. I think you might have to click one more, Melisha. There you go. So the great thing is that you can take this resource. We won't have too much time to talk about it today, but it's important for you to take this resource. You can find it on our Lung Association website, or you can scan your phone to the screen, and you can have a copy of this in your school, so that you know what to do in the steps of an asthma episode, so that you know how to respond to an asthma episode. So the first step is you want to make sure to help the patient stand up into an upright position. Then the second step, you want to make sure that you have access to that quick relief inhaler, to that quick relief medication. Just like Melisha was mentioning with the asthma action plan, and the tips for the caregiver is to make sure that in the school you have these medications readily available. So that's why you need to have access to that quick relief medication. The third step is to follow your asthma action plan. So you want to make sure at every school year you are having that updated asthma action plan, because depending on the child's level of control, the instructions might change. So what could have been useful last year might not be useful this year. So that's why it's important to always have a new plan every single year. And in some school districts, you might need the medication administration form. So the fourth step is to get help, especially if you're starting to see those retractions. So retractions is when you see like the person's shoulders starting to go up. You start seeing their collarbones. You start seeing their ribs showcase a little bit more. This person is not breathing. You saw those signs of a severe distress, that bluish tint around the nose and mouth. They can't talk. This is signs of respiratory distress, and you need to get help and call 911 immediately. So next slide, please. Again, so if you are handling a breathing emergency, these are again the steps. This is a very important takeaway, because this is life or death for a student. So you want to make sure that you are able to identify these different characteristics of respiratory distress, and knowing and feeling empowered that if someone is experiencing this, that you could have their quick relief medication, you know what to do, and that you are calling 911 to get this person help as soon as possible. Next slide. So what to do after an asthma episode. So the scary part is over. Hopefully this patient, the student had the help that they needed, that they were able to take the medications that they needed to feel better again. So this is what to do after an asthma episode. So activity can resume. So we want to make sure that the person can resume their normal activity when they're not having any more symptoms. So again, those coughing, wheezing, shortness of breath, chest tightness, they're feeling good. They can walk and talk easily. They're behaving perfectly fine, and that their peak flow reading, if they are using a peak flow, is at 80% or higher of their personal best. But with that being said, it's also very important to just note that after someone had an asthma episode, they are at greater risk of having another episode several days later. So still continue to monitor the symptoms, keep in contact with the healthcare provider. Hopefully, after that episode, you were able to schedule a visit with your healthcare provider. You were able to schedule so that the student can go in to see their doctor, and that all asthma medications are readily available. And let's say that they weren't readily available during that asthma attack, that asthma episode. Hopefully I hope that there is not a next time, but if there is a next time, that you have those medications there for that patient, for that student. Next slide, please. It's also really important to recognize when your asthma is not in control. So we went over the respiratory distress, but it's also really good in general to know a rule of thumb, or the rules of two, of when someone's asthma is not in well control. So did the student take the quick relief inhaler more than 2 times per week? So this is good for uh, the staff or caregivers to know that if you see someone taking it more than 2 times a week, not for exercise-induced asthma, not for pre-treating, but they're taking more than 2 times a week, it's an indication that their asthma is not well controlled. For parents, are they waking up more than 2 times per month with symptoms? Are they coughing? Are they wheezing at nighttime? They're waking up, they're feeling restless because they're not able to sleep, because their asthma is not well controlled. And also, are they refilling their quick relief medication? So the albuterol, are they refilling it more than 2 times per year? All that is an indication that someone's asthma is not well in control. So we like to, go over the rules of two, because it's an easy way for caregivers and for school staff to know when someone's asthma is potentially not in control. Next slide. And overall, we want to talk about the goals of asthma control. We want to make sure that every person with asthma gets here. We want every person with asthma to feel in control of their asthma, and that they're able to live the quality of life that they dream of. So we want them to not have any symptoms. We don't want them to have any symptoms at all. We don't want one, we don't not, we don't want none. So no coughing, no wheezing during the day or night. We want to minimize future risk. So we want to minimize the likelihood of having that severe asthma episode, that sign of respiratory distress, that they have to go to the ED, they have to be admitted into the hospital. They have to go to urgent care. We want to minimize those future risks. We also want an improved quality of life, especially for children. They're at school, they're there to learn. They're not there because of their severe asthma, to go to the ER, to go to the urgent care. We want them to live a good, healthy life. No missing school, and for the parents, no missing work because of their child's uncontrolled asthma. Next slide, please.
And I'll take it from here, Stephanie. So,
Thank you.
so now we're going to take a look at the community, like the next steps, right? So, for both our caregivers and our school staff, right, we want to make sure that we create that asthma-friendly school environment. We want to be supportive for our children with asthma. So, we want to make sure that we have those clean classrooms, right? That classroom that is free of triggers, right? We that has a good ventilation, has good just being mindful of the indoor air quality, right? I will recommend also the Lung Association's Clean Air School Challenge, which empowers our K through 12 schools to create that healthier learning environment and improve children's health. So please take a look at this particular program that's going on and visit the Lung Association's website to learn more. I've had also teachers in classrooms who work on this really great do-it-yourself indoor air cleaner where they create their own indoor air cleaner from affordable and simple tools where they can create that for their classroom. They get the kids involved, and that's their little project, really. And even our caregivers, go into your child's classroom, take a look around, spot those triggers, have those conversations. You want to make sure that that environment is free of triggers and everyone is aware of your child's asthma. We also want to take a friendly approach, right, and look at physical education and sports. So children with asthma should be encouraged to participate fully whether when their asthma is under control, and exercise is healthy and it should not be avoided, right? So really have our coaches really take that dive into asthma education, learn more about asthma through asthma basics. We also wanted to share another course that's online called Athletes in Asthma. It really dives into that coach education on how to recognize asthma and how to respond. I'm also going to stress communication, right? It is key. It is key. Every adult in the school community, they have a role. Teachers, coaches, even our bus drivers, right? So communication with caregivers really makes the difference in managing a child's asthma. Also, we can't talk, so we can keep talking about this, right? How training and education is important for everyone, but especially our staff. Every adult in the school, teachers, coaches, buses, even cafeteria staff, they should know the basics of asthma care and asthma emergency. We want them to be confident and to support our students with asthma. And you can even provide those training during professional development days. We have a great course on the Lung Association's platform called Responding to Asthma Emergency in Schools. And this is a course more geared to our non-clinical staff. And that's a great tool to share with the school community. Also, we want to provide asthma self-management education to our students and our caregivers. We want to be able to provide opportunities for families to learn more about asthma, right? Even all students to learn more about asthma and offer these programs for our students with asthma. We have our Asthma Basics, once again, that's an online course, and we can share that with families as well. And diving into programs for students, I'll just quickly touch on the Lung Association's programs. It's Open Airways for School and Kicking Asthma. These programs, they teach children how to manage their asthma in a fun and an interactive way. So for families, ask your school if these programs are available and encourage participation. And for our staff, try to promote these programs in your school, right? It's a great course. It helps students really manage their asthma and learn. And there's a parent component, so whatever the student learns, that education goes home to the family. And then finally, just the key takeaway, right? Caregivers, just try to get that updated asthma action plan, get those medication in the school, share your child's triggers and symptoms. Our school community, please ensure, right, that you know which children have asthma, understand their asthma action plan, recognize their warning sign, and just create that safe environment. And together, teamwork prevents September spike, and it can keep our kids in the classroom.
Awesome. So really quickly, I know that we're against time, but just to reiterate some of those really great learning modules and resources that Melisha was mentioning, you want to ensure that every person at the school personnel receives the asthma self-management education training. And of course, we can send an email out with all this information. You want to make sure as a caregiver that you are engaging schools and your district in building asthma self-management education for students with asthma. So as a caregiver, you can empower, you can um, go to your school and kind of let them know the importance of having asthma self-management education and really empowering your student with asthma with a lot of these great resources and training. So we can give you some information on that. And then, like Melisha mentioned, we do have our asthma basics course, open airways for schools, and kick in asthma programs if you are interested. Next slide, please. More educational opportunities. These are found on our Long Dot Training website. So please scan your phone on that QR code. And it's going to take you to a long list of really great resources that we have here. And we definitely recommend the responding to asthma emergencies in schools training, especially if you're working at the school. Next slide. More resources. This is for the families, Asthma Basics. You're gonna, hear us at nauseum with Asthma Basics. It's a really great 1 hour course, so please take it if you haven't already. There's also for children, the Asthma Superstars, so Asthma Spotlights. Really recommend that. There's a really nice takeaway at the very end as well. And for parents, please visit the American Lung Association website for a lot of great information on back to school with asthma. Um, and there's great checklists. There's just a lot of great information. Lastly, we have our Back to School with Asthma information. We have our Indoor Air Quality Schools Guide, our Healthy Lungs. So please feel free to scan those QR codes for more information and to download the booklet. Next slide. Okay. And in this last minute, we just want to stress the importance of our lung helplines. If you have any questions on asthma, any questions of any lung disease, COPD, it could be lung cancer, it could be absolutely anything, please call our lung helpline. It is a free service, and there is bilingual speakers, and there's also interpretation services to over 250 languages. So please call. Um, we're there at any time, basically. And the last slide, if you have any questions, please feel free to reach out to Melisha and myself. I know that we didn't have opportunity for questions, but if you have any questions, please feel free to email us and we will email you back with our best answer. And again, thank you so much for giving us your time this afternoon during your lunch break. Hopefully you learned something new, and together we can, of course, help students take control of their asthma, reduce avoidable hospitalizations, emergency department visits, symptoms, and really regain power over their uncontrolled asthma and lead a great quality of life. Thank you so much, and we hope you have a really beautiful day. Thank you.